So you sprained your ankle. What do you do now? Welcome to Simplicity Healthcare. This is your weekly Wednesday wellness check-in, and today we're going to talk about sprained ankles. So a sprained ankle can be very painful. Sometimes I tell my patients it would have been better if the thing broke because it would heal faster and is less painful. Sprained ankles are caused by damage to your soft tissues and ligaments, and it can take several weeks to months to stop feeling the effects of a sprained ankle. Symptoms of a sprained ankle include immediate pain, swelling, redness, discoloration. You might feel a little bit of heat coming off of your ankle or foot. It may not even be unusual for your toenails to turn a little blue. Sometimes we are in so much discomfort that we're quite sure that the ankle is broke, but really it's just a sprain. So what can you do for it? Well, at home, there are very simple things that you can do. The first thing you want to do, the acronym is called RICE. RICE, like the rice we eat, RICE. It stands for rest, ice, compression, and elevate. So if you find that you sprained your ankle, the first thing you want to do is get off of the foot. You want to rest. You do not want to bear weight on it. This is an injured part of your body, and by bearing weight and continuing to walk on it is only going to cause you a longer period of time to recover and more pain. So rest. Whatever you've got to plan that you got to do, it's going to have to wait. Rest. The second step in RICE is ice. So you want to take a bag of ice and put it on the extremity. By putting ice on the extremity, what that does is it immediately helps to decrease with swelling. Okay, because right away those tissues are injured and they're going to expand, but this is going to help to decrease some of the swelling. Other things that you can do to help with the swelling is an over-the-counter medication like ibuprofen, or Motrin is another word for ibuprofen, or any anti-inflammatory, because that is going to help reduce the swelling. So if you're applying ice, you want to put it on the affected part of the body, the ankle. You don't want to put this directly on your skin. Never put ice directly on your skin because it can damage the tissue. So you want to put even a towel or something in between your bare skin and the ice. So put this on, and you want to leave it on for about 15 or 20 minutes, and you can do this several times a day. Okay? If you don't have a bag of ice, you can use a bag of frozen vegetables. It is great. Frozen vegetables can mold to the shape of your body part that's affected. It will mold, and you can put it back in the freezer and eat it for dinner. The third thing in RICE is compression. So ACE bandages are available over the counter. You want to wrap the extremity in an ACE bandage, and that also helps to decrease the swelling. It also gives you a little bit of extra support. Once you wrap the ankle, you will find that you will have more support and you're able to stand and maybe bear weight a little better. Do not apply the ACE bandage so tight that it cuts off circulation, because you will cause yourself more damage than good. You should always be able to slip at least 1 to 2 fingers into anything that you are wrapping. Otherwise, you will have a tourniquet effect. And the last part is elevation. You want to elevate that foot or the extremity, elevate the ankle, the foot, put it on a pillow. That will also help reduce the swelling. Okay, so when you have your foot down, all the fluid and gravity works, and it brings the fluid down to your foot is your lowest point. So that's going to cause swelling. If you elevate it, it's going to help reduce the swelling. Okay, so elevate it. Last thing I want to say about this is ice is applied for the first 24 hours. You can use a heating pad after that. I also tell my patients, if ice makes you feel better longer than 24 hours, go for it. Sometimes it's all about what's going on up here. So this has been your weekly Wednesday wellness check-in. I hope that you learned something today. We talked about how to care for a sprained ankle. What you can do at home is rest the extremity. You don't have to be running and doing whatever you was doing on it. You don't want to cause more pain and damage. So rest it, ice it. You can apply this for 15 to 20 minutes several times a day. Remember not to put this directly on your skin because you don't want to cause hypothermia or damage to tissue or the skin. Compression, you want to wrap it with an ace bandage. That helps to also decrease the swelling. Remember not to put it on too tight. You don't want to create a tourniquet effect. And lastly, elevate it. Keep that foot up and Netflix and chill. All right, I hope you enjoyed this. I will see you next Wednesday for your weekly wellness Wednesday check-in. Take care, guys.